I mean, it is like stuff like spin around, stand on your head, take one at this time, and then, pray to the moon gods, and then take another one. And then it always says, use a backup method. It's like, why am I doing this? But anyways, these are, yeah, anyway, it's just, and there's tons of them. There's lots of different kinds. I promise you probably could get these pretty free at this point, or $1 or $5 a month. You are taking hormones. I know a lot of people don't like that. They say, I don't want to take all those hormones. They do have added benefits though. Okay. There are some negatives for sure. It made me very nauseous. It made Bella very nauseous. But there's some benefits. So if you have very heavy, painful periods, if you are really struggling in such pain, if you're passing out, if you're vomiting, pills can help ease that. If you are on the moody side of your periods, if everybody knows you're going to turn into a demon, then you're suffering from those hormonal changes. Okay, so pills can ease those symptoms as well. We know that they can help with acne. We know that they can help with, gosh, what else? I just lost it. Anyways, maybe when I go over this section, it'll trigger my memory. So there's all of these pills now you have combination pills that have estrogen and progestin. You can have what they call a mini pill that only has progestin. That's what I was on, and apparently you have a greater chance of becoming pregnant on a mini pill. And so I didn't know that either. I couldn't handle the estrogen, and that's what made me so sick. So there's all of these different types. There's ones you take for 21 days. There's ones you take for 28 days. They're all trying to do things these companies are trying to do things to increase your efficacy, right? So that you're not messing up and you're not getting pregnant. Some of them, obviously they block some of these hormones that you're suffering from. They block the egg from maturing and ovulating. They can also stimulate the cervix so that mucus stays thick on your cervix. Around the time of ovulation, remember that mucus becomes very watery and allows sperm right up in there. So if that mucus stays thick around the cervix, then it also will kind of block the sperm from getting in. They are convenient. They're very cheap. They are effective, right? I mean, they still have an A rating, right? Even though 8% become pregnant, they still have a 91% effectiveness rate. They are easily reversible, and I am proof of that. And now Rebecca said she is proof of that. You don't even have to stop taking them and wait a few months. You can literally miss one and have a baby. Okay. Now, some people say, well, I had a hard time getting pregnant once I stopped them. Maybe, I don't know, but I am evidence for the contrary. Okay. So if you stop taking them, you can become pregnant immediately. Yes, there is an increased chance of breast cancer, and that is a big one, right? We don't want to poo-poo that. We don't want to brush that off, okay? Glaucoma, perhaps, depression. When you start messing with hormones, you always want to be careful with things like that. The biggest one I can think of course, other than the increased risk of breast cancer, is smoking, okay? Taking these hormones affect your blood and your blood clotting, okay? There are people who, once they start taking hormones, it causes their blood to clot. So there are cases of girls that start taking birth control pills and they have a stroke. Okay, it's very rare, but it happens. If you've ever known a pregnant lady who has to do those shots, those heparin shots, so that her blood doesn't clot, okay, so something with the hormones is causing women's, sometimes their blood to clot. Now, smoking also causes your blood to clot, okay? and you add age to this. So the FDA has something that is called a black box warning. It's a contraindication. You cannot do this. You cannot smoke, be over the age of 35, and take birth control pills. Okay, so that one is absolutely like contraindicated. You cannot do that. Now, I advise if you're young and you're taking birth control pills, I would be really careful if you're also smoking. I know you're younger than 35, and so your risk isn't high, but you're giving yourself two whammies. Okay, so really be careful with that. I don't want any of you all to have a stroke. Strokes are horrible. All right, I'm off my soapbox. Progestin only pills, again, work mainly by affecting the cervical mucus. This is why I had two babies. And so they're not great. No one told me that. My doctor did not tell me that, or maybe he did and I didn't pay attention. I don't know. Vaginal rings, the shots, the patches, they all work. Just like I said, they slowly release hormones. Okay. So here's the patch. They advise you every month to move it in certain different sections. You can put it down above your butt cheeks. You can put it on the front, like your, I don't know, right below your tummy or above your hip. Some people say the worst part of this is, you wear this for 3 weeks, you take it off for 1 week, you don't have anything, and then you put another one on, a new one, okay? Have you ever tried to wear a Band-Aid for a few days? After 3 weeks, they just say that this thing gets really gnarly, okay? So that's the worst complaint that I know of for the patches. But this would have been nice for me because I wouldn't have to remember to take a pill every day, right? So that might have been a good deal for me. I don't know. The vaginal ring, they're squishy. You squish it and you put it up inside, and then it just stays up inside your vagina, okay? You can't feel it, I don't believe. They say there's really no, side effects, or, well, I mean, you can get nauseous, get weight gain, all the same stuff that you get from hormones, but it just stays up in there, okay? And then you leave it up there for 3 weeks, you take it out, do nothing for a week, and then you put it back in, a new one back in for the another 3 weeks. Here's the Depo-Provera shots. You go once every 3 months for these. Some people say that they really made them sick, that they bled a lot through the 3 months. I don't know. So things like that. Okay. All right, here's a Belle. This is what my Bella has, okay? This Nexplanon, this implant. So lasts for 3 years, extremely reliable. It does have to be inserted by a doctor and removed by the doctor. We did not pay, which is amazing. I don't know why, but our insurance did not pay, our insurance paid. We also, and I don't know if this matters, Bella wanted to go to a female gynecologist. And so her doctor recommended 2 people. One we know, so Bella was like, I do not want to go to her. And then so she wanted to go to this other lady, Dr. Reddy, and she's at Texas Tech. So we went down to UMC and we saw this doctor. Well, Bella did. I didn't go in because Bella's 18. She's an adult. And she absolutely loved her. She could not speak high enough of her. And she got that implant. They do have to numb it, and they kind of with a, like a little, what is it called? I don't know, they cut a little hole and they put it in, and then it's like 1 stitch to hold it back together. And she just put a Band-Aid on it. She couldn't, and wrapped it for 24 hours. And it got pretty bruised. You could see a pretty good bruise going on there. But, in that first day, it kind of hurt. She said it was sore, but after that, it's just, you can feel it, it's there. But she's had no side effects. Her cramps are gone. She pretty much, you know, has a very light period now, which is awesome for her, you know, and she's a swimmer. So, but it doesn't bother her at all in her arm. So right now I could not speak highly enough of this. Okay. Something to consider. These IUDs, how are we doing on time? I could talk all day long. Oh gosh, it's already an hour. IUDs, these get put into the uterus, okay? The doctor has to go through the cervix, or obviously through the vagina, through the cervix, press it up in there, and when it's in place, you see the arms pop up, okay? And then he pulls out the applicator, and this T-type thing stays in there, and there is a string that'll hang down that you have to check and make sure that you can still feel the string on your cervix, okay, or coming out of your cervix, because the nature of the uterus, how it's always building up and shedding and changing, it's not uncommon for these things to start growing through the uterus or getting kind of absorbed into the uterus. It's really dangerous if they perforate or puncture the uterus, okay? Now, those are just the scary side effects. They say they're pretty rare, all right, but it's something to consider. IUDs have the highest rate of causing ectopic pregnancies, okay, that a baby will implant out in the fallopian tube. These things do not prevent fertilization. All they do is prevent implantation. They cause the uterus to become so like angry that there's a foreign object in there that it starts building up and building scar tissue all around it, so that it's impossible for a baby to implant, okay? The Mirena is a new one, and it is plastic, and it does release hormones also. So the Mirena is one that does prevent ovulation, okay? But the copper T is an old one that does not do anything like that. Okay. It's also really hard. Here's a lot of them. It's really hard to find a doctor that will put this in if you have not already had kids, because it can damage the uterus, okay? So usually now there are people who have them, trust me, and I've had girls in my classes that they say, no, I have one. But for the most part, from what I know, OB-GYNs are really hesitant to give a girl an IUD if she does not already have kids. Okay, here you can see Mirena, it stays in for 6 years. These are new ones. I don't even know if Skyla, these are also, they produce hormones, you know, and vary there. Paragard, this is the copper one. 12 years it can stay in, right? Really amazing. Okay. Okay, let's talk a little bit. Fertility awareness. This is just counting, okay? So you count from the first day of your last period, and you count it out a week, and you want to abstain. And then after that, you're okay. So because you're possibly going to ovulate 14 days after the first day of your last period, okay? And you don't have to worry too many days after that, because an egg with no sperm will not survive. Remember that? She like gets all dramatic and she dies right away. You need to worry about the days leading up to fertilization, because those sperm are persistent, right? And they can live there for upwards of 7 days prior to, okay, ovulation. So you could have, so you don't want sperm any of these days, okay? This is a good option for, you know, if you don't believe in contraceptives, you can do the counting method. If for some reason you can't take contraceptives or something like that, you can do these days methods. This one is for a girl who is very regular. You know the day you're going to start. Okay, you know exactly when it's going to happen. If you are not regular, which is a lot of our young girls, right? And, you know, and some women are not regular. They don't start the same day every month. You have 2 weeks that you cannot have sex. Okay. These are just different ways to count, or not count, but ways to measure, like standard, you're counting. Some women, you can check your cervical mucus, your discharge. If it's really watery, you're probably ovulating. If it's thicker, you're good to go. Also your temperature, right? We know that the day a female is ovulating, her temperature rises that day. So, but these are, you know, even the counting, all of these different methods, you have to be very exact, right? You need to be taking your temperature at the same time. They recommend in the morning, the same time every morning. And you need to get a pretty good, I would say a couple months under your belts for you to start seeing a pattern, okay? You know, if this stuff was perfect, if this was good at preventing pregnancy, you would not have women trying, or because women use this stuff to try and predict when they're ovulating so that they can get pregnant. If it was an exact science, our fertility doctors wouldn't be making millions of dollars. We don't know, and that it's hard to become pregnant for some of those girls that are trying. So to use this as a way to not become pregnant, I don't know. That's kind of iffy to me. I don't know if it's an exact science. Okay. But well, okay, here's my other jab. If your religion says you can't be using contraceptive, then I would argue your religion probably is saying you shouldn't be having sex, right? Especially premaritally. So we can't pick and choose which rules we're going to follow with our religion, right? Now, if you're married and you don't want another kid, I 100%, you know, understand. And this is going to be your best way. Also, the withdrawal method, right? Have him withdrawal. It's not great, but it's something, okay? Sperm also may be in pre-ejaculate, pre-cum. Okay, so you don't want, you just got to be careful. Those sperm are, they're good. Okay, they know how to get where they need to go. This is, they're saying all these hormones that girls are taking, you know, you go and we throw them away or we pee, you know, and it goes into the water system. And these male frogs are now able to kind of switch to female frogs and they can have babies. And they're thinking it's because of all the estrogen that we have in the water system now that's kind of messing up these animals. I might have gotten that wrong. I think I got it right though. Oh my gosh, we're not going to be able to get through all of this stuff. Emergency contraceptive, Plan B, Ella, I might be missing another name, the morning after pill, all these different things that you want to call them. These are high doses of hormones. If you go to the pharmacy and you ask for Plan B and they don't have the brand name, they give you the generic. That generic is a stack of birth control pills. You're not just taking one of those little containers that had all the pills in them. You're taking 5 or 6 of them. You're taking like 100 pills at one time. Okay. For girls who say they don't want to take hormones, but then for some reason are a-okay with going and taking emergency contraceptives when they need to, you're taking way more pills than necessary. You're taking way more hormones than you're even if you had just taken one every month. The one thing that really made me mad about Obama's administration was this, that he made emergency contraception available to everybody 15 and over without a prescription, which it makes no sense. These are hormones. If you have to get your parent consent or a prescription for monthly pills, you should, in my opinion, have to get a prescription for this because it is such a high dose of hormones. I don't understand that. Now I'm okay. I'm not sitting here saying all girls have to get parent permission. I'm not saying that. I'm just saying this, it doesn't make sense. And we have a lot of girls that are taking Plan B as a birth control method. They take it regularly. They go in, they have sex, and then they go to the pharmacy and they get this. And that is not the way it's supposed to be. Also, it's not even that great. It is not that good at preventing pregnancy. If it is already fertilized, you are going to get pregnant. This is not a birth control or like an abortion pill. If it's already fertilized, it's not going to block implantation. The only thing this is trying to do is to try and stop ovulation within the next few days. That's all it's going to do. Now, if it's a serious case, because I can't imagine a girl would just go do this after one mess up. I would say after a rape case or something like that, they could go in and put like the Paragard right away. And that is really good. That would, because she might have been already fertilized, and this will prevent implantation. Okay. But again, these are emergency. There's a reason why it's called emergency pills. Sterilization, female, right? They tie their tubes. A vasectomy, they cut and tie up the vas deferens. I 100% recommend a male vasectomy over a female sterilization for a number of reasons. Now, if she's getting a C-section and the doctor's going to be in there anyways, then sure, go for it, right? Matthew was a C-section. My stomach was already cut open, so it was very easy for my doctor to tie my tubes. Had he been a vaginal birth, I would have had to go back, go to the hospital, pay for anesthesia, pay for a spinal block, pay for my doctor to cut me open and do all of this. A female sterilization is thousands of dollars, okay? A vasectomy is hundreds of dollars. This is an in one day, out in like seriously an hour, maybe. The whole procedure is like 15 minutes. The process, you go to your doctor, they just do local shots, local anesthesia. You're not paying for an anesthesiologist. You're not paying for a hospital room. It's in the doctor's office, snip, snip, they do it. It's brief, it's fast. I watched my husband get done, and it's super easy. Now, I do think it hurt him. You know, I'm not going to brush that off. The shots, I could only imagine that's painful. But the process of them doing it is really easy. There's like 2 stitches on each side. Vasectomies are done on Fridays across, really probably across the United States. They call it Vasectomy Friday because he only has to take off that one day and can really recover over the weekend and back at work on Monday. My husband said that it felt like a constant kind of racking sensation, that it was sore, but he was walking around Saturday. He was pretty much back to normal, fine on Sunday. Okay. So there's that. Here's what they do, right? An incision. They pull out that vas deferens. Well, this is a whole spermatic cord that they have to cut and then find the vas deferens because there's blood vessels and stuff all in here too, and then cut that off. And so then again, this one's showing 4 stitches. I do not think my husband had 4 stitches. He probably had about 2 on each side. Yeah, again, tubal is very invasive, even if it's laparoscopically. Laparoscopic, they still, you're paying, they have to do a spinal block. That's a anesthesiologist. There's a lot of paying in a female's tubal. And this is the laparoscopy, and they're going to cut pieces of the fallopian tube off. They don't literally tie them like in little bows. You always hear my tubes were tied. They cut it and suture it or tie it up. They cut out a whole piece. There we go. And the same idea with the vas deferens. They take out a piece and they clamp off the edges. It's not uncommon though for a little egg to pop out and go right in there. I don't know how, but they do. They know their way, so that can happen. This is just getting into, you know, things to consider, like if you have a child or somebody in your family that is intellectually disabled, you know, you may want to consider contraception when they start getting older. You know, here they're saying the injections, the shots might be something to consider if you don't want that person getting pregnant. Let's see, I'm going to skip all that. You know, we do care about other countries, I promise, but okay, let's talk a little bit about these abortions. So induced abortion, a therapeutic abortion, or an elective abortion. So an induced, or what sometimes we call an elective abortion, is an intentional termination of the pregnancy, okay? A miscarriage is called a spontaneous abortion. It's something that spontaneously happened. The baby was aborted. It was not on purpose, right? The body did this. This is one, I think you guys know the difference between that. Therapeutic abortion is one that has to be done because of the mother's health, okay? There have been obviously cases of, you know, mom finds out she has cancer while she's pregnant, and maybe they choose to do that so she can take chemo and radiation and things like that. You know, all of these topics are horrible. We don't want to think about things like this, but it's real life, right? Things happen to people. And you know, who are we? I say, who are we to judge? An elective abortion, just like I said, can be done for a variety of reasons. There are two types of abortions. There's a surgical and a medical. A surgical abortion has two types. You can have vacuum or a D&E. A vacuum aspiration is the #1 performed abortion in the United States. This is the one most girls have undergone. And I'll show pictures of that. This one, the dilation and evacuation, for some reason, it probably was too late to do a vacuum. So they go in and they dilate the cervix, and then they evacuate the fetus in a different manner. Oops, I did not mean to do that. You know, I'm just going to be fair and balanced. The #1 reason women give for having an abortion is social reasons. So when you hear pro-life people say, you know, we need to cut out abortion, and it's very rare that someone's going to have a medical condition, that is fairly true. Okay, you can't completely discredit their stance. You may not agree with it, but most women are having abortions for a social reason. Okay, so let's look at those. This is out of 100 women, you know, so 25% said that just the timing was wrong. Okay, 23% said they can't afford it. They're done having kids, or they have grown kids, or they have other people that depend on them, so they can't do it. I don't want to be a single mom. I don't feel mature enough. It would interfere with my education and career plans. Now, here's the first indication of a health problem. Okay, physical problem with my health. So 4%. Here another, you know, 7% possible problem with the fetus, right? Here's a rape case, right? Less than 1%. Husband wants me to, that's a social. Parents want me to, that's a social. I don't want people to know I had sex. That's a social, right? And then other, I don't know what those are. So just to be fair and balanced, right? Most girls are having abortions for social reasons. To me, that does not discredit it. But I guess when you hear people say, well, the chances of this happening are so low, that's not it's not a bad argument. Now, just because chances are low, that's still a lot of people that can happen to, right? There's still, I wouldn't want, if I was raped, I wouldn't want to be forced to have that, but that's just me, if they're right now, if I was pregnant and I got cancer, I mean, I have 3 other kids, I don't know what I would do, but that would be a really tough decision for me. So if there was something wrong with the baby, that one I don't know, but I guess if they were born with, pain and they weren't going to live for very long, I don't know. I don't know what I would do with that one, but until you're in that situation, I think it's really very difficult to say what you're going to do. And even if, right now, I mean, yeah, I don't, it's like my youngest is 10. Do I want another baby right now? I don't know. But I don't know if that would be a reason that I would go and do that either. So, I just say don't judge. Don't judge. We don't know what people are working with, This is the vacuum suction. Okay, so it's an aspiration. It pulls out the contents of the uterus. A medical abortion. So this is where you take the pills. Okay, and you take 2 pills and they cause an abortion, and this is how it happens. Okay, so this is the drug and this is a drug. Okay, this is pill number 1 and this is pill number 2. So during a pregnancy, the mom's body is going to be producing a lot of progesterone. Think of pro, for, gestation, pregnancy. This is literally for pregnancy. Okay, so this is supplying this baby and allowing it to grow. This drug right here, mifepristone, I think is how you say it, it blocks progesterone from getting to the fetus, and it will cause it to detach from the uterus. Okay, and then they take misoprostol, which causes contractions, and the baby will abort. Okay, these are both methods, the vacuum aspiration or this one, they both have risk of hemorrhage. They both have cramping. The vacuum aspiration does have a slight risk of like perforation, but I think doctors have gotten a lot better at them these days. So they're a lot safer now. The vacuum aspiration, you have to be in a clinic and it has to be done by a doctor. This one, a clinic can prescribe these to you and you could be at home. You don't have to be in the clinic. Okay, so that's where those differ. Attitudes towards abortion, people are pretty split, right? Down the line. They say legal in most cases is where most people stand, illegal in most cases, or illegal in all cases. And a small group of people saying should be legal in all cases. Really, for the most part, people agree that, if it's young enough, if it's new, if it's early on, people agree with that. First trimester only, right? You don't have a huge proportion of people that are just a-okay with someone aborting a 9-month-old baby. A lot of people kind of disagree with that. I have read some interesting things though on that end where, if you carry a baby to 9 months and at that point you are having to have an abortion, that's not a happy thing. That's not the mom going in and saying, oh, I just can't do this right now. You wouldn't carry it for 9 months. to only end up aborting at that point. This is for a very serious reason. And it's probably a very hard decision and a sincere sense of loss for that mom. I can guarantee you, I don't think anyone would go 9 months and then decide not to have it. If they did, that would be a very probably interesting and rare case. I think most women in these circumstances, it's for a good reason. And I'm not a medical doctor. I don't know what those reasons are, nor will I stand here and pretend to know what those reasons are. But I agree that, you know, that's not just being done here and there for everybody, you know. You know, the availability of abortion is decreasing here in El Paso. We do have a Planned Parenthood, and we do have a center. This one on Schuster Hilltop just closed. I don't know if it moved anywhere else or not, but here in El Paso, you know, that maybe 2 places where that can be done. And they're becoming more and more widespread, or not widespread, like distant from each other. We don't have very many clinics all around. So, you know, some people might have to drive a significant amount of time to go get a pregnant or an abortion. Sorry, my brain's starting to fry. Roe versus Wade was just that the government cannot come in and get in the way between a decision of a doctor and a mom. And that's what that is. And so, you know, that the government should not come in and dictate what's going to happen. And I think for the most part, we would argue that the government should not get in between a doctor and a person on any health decisions, any at all. And so this is just one of those. But I understand. My mom has a house for homeless pregnant women in California, and her primary push is she's anti-abortion. I mean, she is pro-life, and so she has this home, which is great, but she is very pro-life. And so, you know, she says no baby should be killed, and you know, you can't sit there and say, yes, babies should be killed. I mean, it's like hard to kind of say against that. I don't think so either. I do agree with that statement, but I think to completely wipe it off the table is not going to work either. I would rather get to no unwanted pregnancies, you know, increase education, increase contraceptives, availability of contraceptives, you know, so that situations don't happen like that. Educate our middle schoolers very, very well, because they're already having sex, I promise you. So this abstinence only is just not working. But anyways, I'm done again. Any questions here, or thoughts, comments, or concerns? No? All right, so think through all those different birth control, you know, and also obviously, okay, here, this will make my mom proud. The only way to be 100% sure you are not going to get pregnant is you do not have a penis in a vagina. I'm just kidding. She would not be happy with that last part, but she would say 100% abstinence. But let's be honest, right? Let's be real. 100% no penis in a vagina. And that's it. I'm done. I went over. I'm sorry, guys. All right. You guys are good?
Thank you.
Okay. Thanks, Rebecca. I'll see you guys next week.
Bye, everyone.
Bye. I think they.
Bye.
Oh, bye. Bye, guys.